function of ligaments is to connect bones to bones for stability. So if we look at the ligaments of the spine in particular, there are a variety of different small ligaments that attach various vertebrae at different points. So when we look at the various spines, you see these bony processes. There are ligaments that attach those bony processes. The same thing on this side. You have some that attach in the middle of the vertebra to this side. But basically it's creating the stability of the spine, allowing a certain amount of movement, but restricting that movement. The muscles are what create the movement, the ligaments are what restrict it. So it's essentially a balance between those two to keep symmetry and to keep functional movement without injury. We just spoke about the ligaments and the connections of the ligaments and the fact that ligaments create stability for the spine. So what does an actual ligament consist of? Similar to muscle, it consists of a bunch of fibers lengthwise that are parallel with each other and create the length of the ligament. Similar to muscle, except that ligamentous fibers do not contract and relax like muscles do. They essentially are fairly stiff, allow a certain amount of movement, but then don't go beyond that. So a ligament sprain essentially is when those ligaments are stretched to those limits, but go beyond that through injury, through repetitive doing something. And what happens is those fibers, certain fibers in the ligament, will actually tear. And depending on the number of ligamentous fibers that tear, depends on the extent, or will determine the extent of the injury. So a first-degree ligament sprain is a small amount, say under 25% of those fibers are torn. A complete rupture is a fairly serious condition and usually requires surgery. So I described the ligaments, the function of the ligament, what they do, connect bone to bone for stability. But when we look at spinal conditions specifically, I'd like to point out some things here. So if we look at what the ligament does in terms of the spine, we see that the various vertebrae are moving relative to each other. And the muscle is what's contracting and relaxing, creating that motion, whether it's forward bending like this, or rotation, turning. Each vertebra has a little bit of movement in 6 different directions and combinations of those directions. So the ligament is keeping that stability there so that, say we rotate, we're trying to rotate, you can see bone hits bone and creates that limitation. And that's only because the ligament holds it in that position. If, say, the spine is bending and bends beyond the bony elements, now the only thing creating that stability is the ligament, not allowing motion more than it would have with the bony contact. So in injuries of the ligaments, when the spine goes into these positions, there's nothing preventing that excessive movement, and that's when it starts affecting, say, the nerves which are coming out here. If there's a lot of movement, it can press on the nerve and get stuck there.